Yeah, so this year at Lugano, here at ICML 2025, we presented a poster looking at infections in both patients who received CAR T-cell therapy, autologous, CD19 targeted CAR T-cells, mainly axi-cell and tisacell, and patients receiving treatment with CD20, CD3 targeting bispecific antibodies, both in monotherapy or in combination, commercial or in the setting of clinical trials. So we wanted to look at the rate of infections, both cumulative incidence and the type of infections, were they bacterial, viral, fungal, and we looked at that across our cohort of patients with relapsed refractory large B-cell lymphoma who had received CAR T cells or bispecifics, or interestingly, both products. So we do have some patients who have been exposed to both bispecifics and CAR T in one or another given sequence. And we wanted to explore the concept that perhaps for dual receptors, those who have received both bispecifics and CAR T, the rate of infections can be significantly higher than patients receiving only one of the T-cell redirecting modality strategies. So we did have some exciting conclusions. We did see, significant rate of infections, and I think this is going to be, a growing body of data in the future. So we know all about CRS and ICANS, but I think definitely infections are sometimes not as well represented in the trial reports, not represented in detail, in terms of severity, in terms of type of infection. So I think it's very important to be looking at this for the future when, sequencing is on the table and we're deciding which way to go. Definitely, the risk of cytopenias, of infections, of secondary malignancies, all of these, later, let's say, adverse events are going to become key when we are selecting which given sequence we're going to offer our treatment. So what we saw is that, in fact, patients have been exposed to both T-cell redirecting strategies, as could be expected, higher risk of infection, a higher cumulative incidence of infections, and that's something we have to look, with more follow-up and larger cohorts, but it's definitely something we're going to follow up in our own site and present at future meetings.